October is the Breast Cancer Awareness Month. So, in this month, we would like to give certain information to all women of the country that how breast cancer needs to be tackled. You must have known about how early detection of breast cancer helps. What are the signs and symptoms of breast cancer? Now, I would like to tell you that breast cancer is something which you should not be afraid of, because this is one of the cancers which is highly curable. And if you look at it, even for stage 1 breast cancers are almost stage 1 and stage 2 breast cancers are curable to the extent of 90% to 100%. Even stage 3 and stage 4 breast cancers may not be cured, but they can be continued for a normal life for a long period of time with multiple lines of treatment. Now, when we decide on treatment of breast cancer, there are multiple options of treatment, of which surgery has still remained one of the landmark treatments of breast cancer. Now, surgery can be extend from modified radical mastectomy, which means removal of the breast, to just removal of a lump and removing one or two nodes which are called sentinel nodes. So there is a wide variety of surgery. Even for mastectomized patients, that means the breast has been removed, there can be a reconstruction of breast made so that you don't look like that you have lost your breast. So this is part of surgery. Coming to radiation, radiation is one of the most foremost treatment of breast cancer, which is normally given after mastectomy in certain stages of breast cancer, or if we are conserving your breast, that means if we are protecting your breast, we would like to give radiation to that breast to maintain that so that the disease does not come back in that breast. So this goes of radiation. Radiation with modern day machine is absolutely painless and very precise, and it can be done very easily. Coming to the most important part of breast cancer treatment is hormone therapy and chemotherapy. Now, hormone therapy essentially is done by tablets, where a special variety of breast cancer, or what we call hormone receptor positive breast cancer, where estrogen and progesterone receptors are positive, either one of them or both are positive, and they can be treated with tablets, oral tablets, varying in range from 5 years to more than that, or lifelong treatment. Sometimes we add new drugs to it, like the CDK4/6 inhibitor, which has come of late, for advanced stage 4 diseases as well. There are multiple hormonal agents, mostly oral tablets, but there are injectable intramuscular agents as well, like drugs called fulvestrant, which can also give good results. The beauty of hormone treatment is that it is usually symptomless. There is not much of adverse event, and patients can continue it for lifelong and long periods of time, and can give excellent results of breast cancers. By the way, we must know that if you are hormone receptor positive breast cancer, that means you are usually a good prognostic breast cancer. That means your chance of survival is much, much higher. The other most important part of treatment is chemotherapy. And if you look at chemotherapy, essentially people are scared of chemotherapy because of the adverse event of hair loss, diarrhea, chances of infection. But most of these adverse events are transient, and they get over in a short period of time. Chemotherapy, by the way, has been very meaningful for breast cancer, and apart from hormone therapy, chemotherapy is the other treatment which has improved overall survival of breast cancer. Chemotherapy can be given in conjunction with hormone therapy or alone, and chemotherapy can be given prior to surgery, which is called neoadjuvant chemotherapy, which is essentially given to reduce the disease bulk, or it can be given after the surgery, which is called adjuvant chemotherapy, or in advanced stage disease where without doing a surgery one can give chemotherapy. There are multiple drugs of chemotherapy which are usually given in combination or singly, and usually given either on a weekly mode or in a 3-weekly mode or on a bi-weekly mode. The new drugs which are coming in is the targeted therapy, and there is a group of disease called HER2 positive disease, where certain drugs are very important called anti-HER2 antibody. There are drugs like trastuzumab, pertuzumab, and some oral drugs like neratinib and lapatinib, which are excellent drugs in controlling breast cancer. And they are usually used in combination with chemotherapy or hormone therapy, and they give excellent results to particular group of breast cancer which show amplification of HER2 new gene. There is another variety of disease called triple negative breast cancers, and nowadays we look at BRCA-NES or BRCA1 and 2, which are certain familial genes which run in families for breast and ovarian cancers. And if they are positive, one can treat them with a new drug called PARP inhibitors, which is called olaparib, and there are new other drugs coming in called rucaparib and other drugs. And this can again improve quality of life, survival, and others in breast cancers. Immunotherapy, which is the new kid in the block, is also being developed first for breast cancer, though it has not made huge dents in breast cancer treatment like it has done in other cancers, but probably in near future these drugs will come in. The other new drugs which are coming in is PI3 kinase inhibitors called alpelisib, which are again coming up after second line hormone failure or third line hormone failure if they show these positivities. So in general, if you look at breast cancer treatment, apart from the traditional surgery, radiation, chemotherapy, new drugs are coming in, hormone therapies and new hormonal agents, new targeted agents, immunotherapy and other drugs. And overall, it must be understood that breast cancer is a disease which needs to be diagnosed early, because if you diagnose breast cancer early, you cure them for a life. And even if you cannot diagnose them early, if you diagnose them pretty late, there are so many treatment options available that you can go on and give them quality of life and meaningful life for a long period of time. Thank you.